Tim Hrenchir, a reporter for the Topeka Capital Journal, here with Shawnee County's Health Officer, Dr. Gianfranco Pezzino, who has the power and the responsibility to take whatever steps are necessary to save lives during the current COVID-19 pandemic. Thanks for being here, Dr. Pezzino.
My pleasure. Thanks for inviting me.
During this 30-minute podcast, which will end right about 4 p.m., the public will be able to suggest questions over Facebook, but we'll start right away with a question relating to the statewide stay-at-home order, which will remain in effect through at least May 3rd by what the governor has said. My question, with multiple other states preparing to open up, how much pressure are you and other officials under to return to normal after that order expires?
I think that the pressure is definitely there, coming from multiple sources. But honestly, I think most of us don't need the pressure in the sense that we are very well aware of the pain and suffering that these measures have caused to our population, to our communities. Personally, I can speak for myself. I don't need any reminders. I know that. I knew that when I signed the first order that closed restaurants and bars, and I was thinking about the people that I know or my friends' kids that I knew that they would lose their jobs. And so that's always remained in my mind, and I never lost track of that. What I'm seeing now is that it's a couple of things. First of all, I'm seeing that people are becoming a little more impatient, and I can relate to that. I'm becoming impatient myself. Look, I can't stand it anymore to stay home all day. I mean, I'm working from home, so those are long days of work, but still, we want to go back to our normal life, right? It's a beautiful season out there. It's a wonderful spring. We want to go out and enjoy ourselves. We want to go to the park. We want to go to the movies, whatever. We want to go out for dinner. We want to do it. I think that people's impatience is becoming bigger, in part because we have been able in Shawnee County to mitigate the effects of this virus in the last couple of weeks more than perhaps in other counties. Not because we are better than other counties, just because of a combination of reasons, and in part is luck, in part is preparedness, in part is the incredible job that our public health nurses are doing in tracing cases and things like that. But for whatever reason, our numbers are relatively good. So I can only imagine putting myself in the shoes of the average member of our community. And they look at those numbers every day and they go up by 1 to 0 from the day before, and yet I'm stuck home. I can't go out and work. I'm not making a living. My business is closed. Why am I doing this? That is a kind of pressure that I'm starting to feel more. And again, understandably so. I still believe we can do both. I really believe so. I believe that there cannot be a healthy community without a good economy. If people cannot make a living and they live in poverty, they can't be healthy. But the opposite is also true. There can't be a strong economy if people are not healthy. And so we've got to find a way to have the two elements walk hand by hand. And that's really what we are starting to plan right now. Just this week and into next week, we are preparing a stepwise approach to what is going to look like when we are going to start lifting these restrictions in Shawnee County. It's not if, it's when. It's coming soon, it's coming as quickly as we can, but we want to do that in a balanced way that can assure both public health and as strong of an economy as we can possibly have.
Okay. A recent podcast described the reopening process as a dance and indicated it needs to be very gradual to ensure nothing is done to cause more massive outbreaks after restrictions are eased. So what do you envision the opening process will look like here in this county?
Yeah, I like that analogy. I like the dance for a couple of reasons. First of all, yes, it is gradual. So, a dance, sometimes you start slow and then you go a little faster. But also the dance usually has some rules. I mean, of course, you can dance without rules, but if you're dancing the waltz, you better know which foot goes first and where, or it's going to be chaos and you're going to step on each other's feet. as I usually do when I try to dance with my wife. But putting that aside, I think it's a good analogy because the way I envision this process is one in which we are starting slow. We are perhaps going to move a little faster later on, and we're going to follow certain rules. We're going to follow certain principles. There is space for creativity, like in real dancing, but there is a set framework that we're going to establish before we start lifting those measures that we all have to follow. The general guidance rules are going to be known, are going to be out there, and that's what we're going to stick to. Then within those rules, you're going to have a lot of space for creativity, creative solutions for people's input, and say, hey, I'd like to do this instead of that. Okay, let's look back to our guidelines. Is that going to be in respect and in accordance to our guidelines, the high level, or is it going to break any of those principles that are so important? So in practice, what that is going to look like is that once we get the green light from the state, and that's an important element that, if nothing else, I hope that people will take this away from today's session. Right now, there is nothing we can do. We are under a state order, stay home, and restriction to business operations, okay? For good reasons. So we've got to respect that, and we can't do anything until the state order is lifted. When the state order is lifted, within probably a day or two, you will start seeing some of those remaining measures being lifted in Shawnee County. The first one that I think will be gone is any kind of stay-at-home order and the ability to go to work and reopen businesses. We want to send people back to work. That's the most important thing. And that may be the only thing you see at the beginning. So we're going to tell people, you can leave your house, you can go back to work, you can reopen your business with some restrictions. There may be a few businesses that in the first few days may not be able to reopen just because the nature of the business is such that there is too much contact between the public and the business operators. And I'm not ready to make any examples right now because I don't want people to jump to any conclusions. And frankly, those discussions are still ongoing, so I don't know. But people need to be prepared. It won't be like switching the light back on and now everybody's free to do anything that we were doing 4 or 5 or 6 weeks ago. But most people will be able to go back to work and leave their house. That will last probably 14 days. 14 days is not an arbitrary number. That's a maximum duration that is believed for this virus to incubate. So over a period of 14 days, we will be monitoring the situation, monitor the trends in our cases, and other measures that we monitor around those cases, how quickly we can detect them and so on, whether we know where the person got the infection or not. If everything goes well, and if the number of additional cases is not too high, then after 14 days, we move into the next phase. The next phase will be, okay, those businesses that in the first phase couldn't really operate because it was too dangerous, now they can reopen, maybe with still some restrictions, but they can reopen. So essentially, all business will be open at that point. And we will watch again for another 14 days. There will still be a limit to some things, especially mass gatherings. If everything goes as we hope, after 14 days, more restrictions will be lifted. Those businesses that were operating under certain restrictions, maybe now they can relax some of those restrictions, not all. Some gatherings that the prior 2 weeks couldn't take place, now they can take place. So you get the idea. It's going to be several steps in 14-day increments that can only happen if nothing bad really takes place in the previous period, okay? How long is all that going to take? My hope is that if everything goes well, and it's a big if, over a period of a few months, we should be able to go back to as much of a normal situation as we possibly can. The only restrictions that I anticipate will remain in place for a longer period are those that affect large gatherings. I'm talking of large gatherings, thousands of people. I'm not talking of a few hundred people gathering downtown for a festival or a food truck festival or anything like that. I'm talking of events that will attract thousands of people, possibly from out of state, possibly even from multiple countries. that's why we want to be really careful, because the potential consequences of introducing a virus in a gathering of, say, 50 people are bad, but we can contain that. We know we have the capacity in Shawnee County to do that. If somebody gets sick within that kind of order of magnitude, our hospital can take care of that, our public health nurses can trace the contact and so on. If something goes wrong in a gathering of 5,000 people, it's a different story. And we may end up with hundreds of cases instead of one or two. And that would overwhelm our systems very quickly. So we're going to be really careful with the mass gatherings, even in the long distance. And I have to be honest, long distance may mean many months, or perhaps even a year or more, until we have a safe vaccine that we can also use.
Okay. Talking about restaurants here, when things get reopened, could restaurants be allowed to open but face some rules on such things as the number of people they can serve, or requirements for social distancing, which would mean capacities in eateries would be drastically reduced?
I think those are all good options. They are options that we are examining. So I'm not prepared to, again, talk too much about details that haven't been decided yet, but those are definitely viable options that we are examining.
What about schools in the fall? Is it too soon to know if they might be able to reopen?
It's a little too soon to know. Things can change in this scenario over a matter of a few days. I think in part the future of our school openings in Shawnee County will depend upon the state once again. I anticipated there will be a statewide approach to this. I'm not necessarily implying that all the schools in the state will be closed or all the schools in the state will be open, but I suspect there will definitely be guidance from the state level about what is appropriate, what is not appropriate to do. So I think it's premature at this point. I strongly hope that we will be able to have at least some class time, if not back exactly where things were 3 months ago, but at least some level of class time. But the extent to which that is going to happen, again, will depend on the current epidemiology of the disease at that time, plus the directions that the state will distribute to the rest of the districts.
Okay. What about organized spectator sports? Do you see those being allowed again anytime in the near future in Shawnee County?
That's a question we are receiving a lot. And again, it's one of the situations we are looking at right now. Where we are right now this week, again, we have developed a tentative framework or reference of what are the general rules of engagement, if you will, to make these decisions. I don't want to make these decisions. Nobody wants to make this decision just on one-by-one cases. Okay, this baseball tournament looks good. We're going to let it go. These are the one. No, I don't think we're going to. I mean, there has to be an even and fair playing field, since we're talking about sports. The people know what the rules are. People know that we are playing by those rules. Everybody plays by those rules. So right now, we just established the general rules. We are not at the point where we can really decide what exactly is going to happen and not. My hope is that there will be some level of sports events. I can't tell you whether it will be the same that it was last summer or whether there will be some restrictions around that. I think some restrictions are actually probably going to be likely, but that's all I can say at this point. It hasn't been decided.
Okay. A recent report indicated that testing and monitoring will likely be part of the process as we, as a nation, open up. As we see increases in some communities, those may need to implement some of the social distancing measures before easing and further monitoring. Do you see a collective community fatigue in that scenario?
Yeah, I talked about community fatigue a little bit at the beginning. I think it's definitely an element to keep in mind, to take into account. I think testing is critical. Those rules that I was referring to that we are developing now have some prerequisites. So for every stage, I talk about 14-day stages. For each of those stages, there are some prerequisites that need to happen before we can move to the next stage. And one of them is always testing. We've got to have the ability to test the number of people that we need to test for that particular situation. We can't afford to have what we were experiencing 3 or 4 weeks ago, where we had sick people in the hospital waiting for sometime a week or more before we knew if they were infected with coronavirus or not. During the time, The staff at the hospital was exposed. They had to use a lot of personal protective equipment which was already scarce and not sufficient for everybody. It was an untenable situation. We cannot afford to do that thing again. Testing has improved dramatically in Shawnee County and elsewhere in the country, but it's still very short of where it needs to be. So depending on where the testing situation is going in the next couple of months, some of our actions will change and some of our ability to reopen our community activities will change. But the issue of community fatigue is definitely something that we are keeping in mind. And I just hope that the fatigue doesn't translate into doing something that's going to fire back on us later on, into saying, I'm just too tired to stay home anymore. I'm just going to leave. We've come such a long way. We've done so much. All we are asking is just hang in there a little bit longer. It's not going to be much longer, just a little bit, a few days, maybe a few weeks at the most. In that way, we can release those measures and lift those measures in a structured and organized way that doesn't put anybody at higher risk.
Do we have anything over Facebook?
We do, yes. Grandma Bruce asked, I want to know if you had it, are you immune?
Myself?
Just in general.
If
I
somebody
see.
gets COVID-19, are they immune then?
It's a novel virus, as we call it, which means it's a new virus. So we are learning a lot while we are living through this experience. At the practical level, the assumption is that people who were infected and now are recovered are immune, at least for a certain period of time. We don't know yet if that's going to be lifetime. It's going to be just for a few months. But that's the assumption. There have been a few reports from China and elsewhere where apparently people who had been considered as cured from the disease were infected again. But those reports are very, very few. They haven't really been confirmed, so we don't know if there was a problem in the testing the first time, there was a problem in the testing the second time, or if these indeed represent some real events where people could be reinfected within a short period of time and be sick again. But right now, the best knowledge that we have, from the practical point of view, we consider people who recover after infection as immune.
Okay, another question here from Johnny walking forward. What about car shows and meets?
It's part of the situation that we will examine next week and part of the special events that we will examine. I'm not ready to speak about those specific events right now. As I said, we are still just discussing the general rules around all and any events in the county. So after those general rules are agreed upon, then we will look into specific situations.
Okay, what about, I apologize. Just another question kind of reiterating that. When, I want to know when I can see my friends is what one person put here.
You'll be able to see your friends not 1 hour later than it is safe for us to say that you can do that. The first thing that needs to happen, as I said earlier, the state needs to say, it's fine, local jurisdictions, you can lift your orders. That hasn't happened yet, and we don't know when that will happen. It could be on May the 3rd, or it could be that the state decides to extend the current deadline, which is May the 3rd, and say, no, we need another week, another 2 weeks where everybody stays home. Once that happens, we will look at the situation, and it's possible that even as soon as the day after, you'll be able to go out and see your friends in a safe way.
Can you explain the difference between the hosts and carriers of this virus?
Well, the term host and carrier are very similar. I think maybe what the person was asking is, what is a carrier and what makes somebody a carrier as opposed to somebody with a disease. The carrier, by definition, is somebody who is carrying the virus or can infect someone else, but many times that person doesn't have any symptoms. And those are what we call asymptomatic carriers without symptoms, okay? Those are the greatest nightmares in public health because I can take care of the people who get sick. because I can recognize them, I can test them, they test positive, they're put in isolation right away, so they won't be able to infect anyone else. I can't control what those people who are now sick were doing 4 or 5 days ago when they were asymptomatic carriers, meaning they were not showing any symptoms, but yet they were able to infect other people. So what we are learning right now is that, number one, people who become sick can transmit the virus a few days before they become sick. And that makes our control activities much more complicated, as I said, because we don't know that they are infecting other people because they're not showing any cough, any fever, any other symptoms. It's the first thing we are learning. The second thing we are learning is that some people actually never develop symptoms. They can be carrier of the virus, can host the virus for a while. During the period, they can be infectious to other people, and then they may recover, they can get rid of the virus on their own, and we will never know that those people were even infectious to others. Again, as you can imagine from the public health point of view, that creates a lot of problems because there is no way to identify those people, certainly not with the kind of tests that we have right now, which can only identify people who have the virus in their throat, in their mouth, and their nose. That doesn't work if people are asymptomatic. We can't just test everybody, once every 4 days, and just to find out a few people may be positive.
And this will be the last question. Is it possible that this was in Shawnee County in December or January?
Oh, December, January, I think it's unlikely. The earliest reports that we have from China go back to a really substantiated report sometime back in January or maybe December, some of them in December. But I don't think it really came out of China at that time, certainly not in the United States. It's more of a gut feeling. I have no data to support that. But my feeling is that we had this in Shawnee County probably starting sometime between maybe the end of February or sometime in March. I think we definitely had it in Shawnee County way before we were able to confirm the first few tests, which was around March 24th, if I'm not mistaken, so the third week of March or so. And at the time I had been saying already publicly, I think the virus is already here. Make no mistake, just because we can't find it with laboratory tests doesn't mean we don't have it. But I don't think it was with us back in January.
I have a question I forgot up here. Why are people blaming vulnerable people for them staying home when healthy people are getting it also?
So healthy people can get the infection, sure. The difference is that the severity of that infection changes considerably with a series of factors, individual factors. The first one is age. Age is a very strong predictor of how serious of an infection people will have. In fact, again, there is more and more evidence that people in the younger age groups, in many cases, may just get infection and never even know that. Now, make no mistake, people who are 14, 15, 16 can get really sick from this virus, but it's a minority of them. Most of them will not. People who are 60 or 65 and older, many more of those people, if they get the infection, will become sick, and some of them will become very sick, and some of them will end up in the hospital, in ICU, and on a ventilator. People who have some underlying conditions that for whatever reason make the virus more virulent can become even more sick. And those are primarily heart conditions, to some extent lung condition, respiratory conditions, diabetes, and any condition that depresses the immune system of an individual. So there is really no winner or loser there, and there is nobody to blame. But the fact is, when we say people with a high risk are really strongly advised to stay home, and they may be strongly advised to stay home even longer after we start lifting our stay-at-home order for everybody, the main reason is not to blame anybody, it's just to make those people safer, because if we don't, we're going to have a lot more victims that require medical attention or require intensive care, they require ventilators, and eventually we may not have all those structures in place to take care of all of them, and some of them will die just because they can't have access to that equipment, or some, even with access to that equipment, will die because the virus has caused so much damage that they just will not survive.
I got an emailed question. A COVID-19 cluster was identified at a local hospital. How does that affect the rest of us?
How does it affect the rest of us? Honestly, not much. I think that affects more that hospital because that hospital was struggling for a while. I understand things are getting much better now, but they took this very seriously. They did what we told them they needed to do, and they put many people, dozens of people, on quarantine because there was a risk that they had been exposed to some people who became sick. So really, the hospital operations were affected heavily by that situation. We, as a community at large, we were affected only marginally. The hospital was always able to keep providing really the essential services they needed to provide. They didn't turn away any other COVID-19 patients. They didn't turn away any critical patients that needed care. So I don't think, I don't know if that's where the question is going. I don't think that cluster represented a reason for increasing cases that we have seen at community level. We haven't found any evidence that cluster then spilled into the community and then caused an increase in the cases we observed in the community.
And if I can just ask this for 1 minute left, what fun things can you give us to do? I'm feeling anxiety, I'm losing my cool.
Well, I'm telling you what I'm doing with my family. We enjoy, I spend a lot of time on video conferencing these days for work. But then a few times we have done video conferences for fun. And just a couple of days ago, we played some remote games with my children. And there is a plethora, a variety of games now that are available as online games. And it's really fun. It's not exactly like being there, but with the video camera, you can show each other. Like there are games where you have to write down some things and you only have a limited amount of time. Show each other what you've written at the end of the period, and then there are winners and there are losers. So it's as close as it gets to being together in person. It gave us a couple of hours of fun and laughter, and that was good enough.
Okay, well, thank you everybody for watching this podcast with Dr. Gianfranco Pezzino. And thank you, Dr. Pezzino, for your work and flattening the curve here. We appreciate you being here.
Thank you.